From the minute I came in to the minute I left the hospital, the staff has been phenomenal. They care so much and they're so dedicated to their job. It's like I say, I'm telling everybody about my experience, my week I was here. I was more short of breath when I was kind of exerting myself, doing things, walking, stuff like that. I went to my own GP who put me to the local hospital near Glasgow. They sent me for an echo scan. They were at a loss because they knew I had a leaking valve at my heart, but they couldn't explain why I was feeling the way I was feeling.
It was very clear to me that Sandy had an underlying condition that remained undiagnosed, and I recommended that he come to London for some tests to reassess his aortic valve, but more importantly, to look to see whether he had a different problem in his heart that could be the cause of his symptoms, namely coronary artery disease.
It was Dr. Birdi himself that suggested, look, we'll get tests done in Scotland, up in Glasgow, wherever we can get them done, or you could come, spend a couple of nights in London, come with your wife, a couple of nights in London, we'll get tests done, and then we'll get you home.
A lot of people think that coronary artery disease presents with chest pain, angina, but sometimes patients can present with indigestion or breathlessness, and I felt that it was really important that we looked to see that this wasn't really the problem.
They gave us a scan, they put the dye in my veins, and that's what actually found the blockage.
We performed an echocardiogram which indicated that the aortic valve was a problem but not significant at this stage. A CT coronary angiogram demonstrated that Sandy had very calcified, narrowed coronary arteries affecting a very important vessel on the front of his heart called the left anterior descending artery, or the LAD.
Dr. Birdi suggested that if we could get an angiogram done, that would kind of ease his mind a bit. So he managed to get one of his colleagues, was a Dr. Sen, to do the angiogram the next morning. When I went to the theatre, Mr. Birdi was in the theatre waiting on me to meet me. He chatted away, just general things. He just chatted away with Dr. Sen. I went in and got the angiogram done. When I came back out again, Mr. Birdi was standing waiting on me. But while I was in the theatre, he'd actually been up to the canteen or the cafe in the hospital to find my wife, to assure her that everything was fine. And it's things like that I mean, I just think the man's, well, I don't know, he's like an angel as far as I'm concerned. He's so sincere, it's unbelievable.
The angiogram demonstrated significant narrowing in the left anterior descending artery, very high up, meaning that this was quite significant. And given Sandy's symptoms, it was important that this was treated relatively quickly.
That's when Mr. Birdi and Mr. Sen together, when I came out the theatre that morning, decided or advised me that I had a life-threatening condition, a blockage in my heart. He says, you can go home if you go back home. I know it's a big decision. You can go back home, speak to your family, but don't leave it too long.
I recommended to Sandy that he seek relatively urgent referral to a local cardiologist or cardiac surgeon when he returned to his hometown. Sandy elected to see whether we could treat him here at Cromwell Hospital, and I was amazed at how everyone in the team rallied together to arrange for Sandy to have his surgery the following day.
Luckily enough, we managed to go ahead on the Saturday morning, and that's when the man saved my life, I suppose.
we performed a minimally invasive direct coronary artery bypass graft to his left anterior descending artery, where we created a small cut between the ribs on the left-hand side of Sandy's chest, and I took an artery from behind the breastbone called the left internal mammary artery, and we sewed this onto the left anterior descending artery in a very controlled manner, with judicious anaesthetic stability being provided to us by one of my colleagues, Dr. Shane George, an expert in this area.
One of the nurses in the intensive care, Alfonso you called the guy, he was an Italian gentleman, he was a male nurse, and he looked after me the first night in intensive care, and he turned to me on the Sunday morning to get me out of bed to sit in the chair, and he asked me, he says, how do you feel? And at that time, that point, I said to him, it's the best I have felt getting out of bed for the last 4 or 5 years. And he gave me a wee chuckle.
The surgery was successful, and almost immediately after the surgery, when Sandy awoke on ITU, he indicated to me that he felt different already. That heaviness that he had in his chest had disappeared, and after a few days, he was ready to go home.
So I was in intensive care for 2 nights, Saturday and Sunday, back in my own ward for Monday. Tuesday I was climbing stairs here in the hospital, and I was home a day early. I get discharged on the Wednesday and was back home in Glasgow on the Thursday.
The artery that we've placed to Sandy's heart should last forever if he keeps an eye on his risk factors. Now clearly he does have a problem with his heart valve, and we will need to keep an eye on that, but in the event that that needs treating in the future, we will also be able to treat that at the right time using minimally invasive techniques.
It's been I would say it's a special part of my life, because I've never had that kind of care before. Mr. Birdi, I mean, he's very, I've never met a man like him, how sincere and knowledgeable he is, you know. Every day I was in after the operation, every day he came to see me. I think everybody went above what they had to do, if that makes sense. They were just so caring and just so understanding. And they always said, even after the operation, even up to a week ago, they've been on the phone, how are you? How are you doing? Any bother, you know where we are. I was even in seeing Mr. Birdi today, 6 weeks after the op, and I left his office there, and they said, any bother, you know where we are.
I was pleased to meet Sandy and his wife in clinic, and absolutely delighted with the outcome. His wound was fully healed within 4 weeks, and he was able to get back to all the tasks that he wished to perform. There was no waiting 12 weeks for the breastbone to heal, one of the great benefits of minimally invasive heart surgery.
And the keyhole is definitely the way to go. Definitely. I do know 2 people. They had the quadruple, triple bypass, but obviously they had to get the bone cut. But with me, only get the keyhole, which is only a 2-inch wound up my left chest. Far better. From the minute I came in to the minute I left the hospital, the staff has been phenomenal. They care so much and they're so dedicated to their job. It's like I say, I'm telling everybody about my experience, my week I was here.